Okay, we're going to do range of motion for the patient. It's going to do it down one side of the body. You will do it on both sides of the body, but we'll do it on the one side of the body. You'll do it 3 to 5 times each joint, depending on the tolerance of the patient, and you don't go beyond the limits of the patient. In other words, if the joint is stiff, you don't push it beyond the limits of that joint. So let's start with the head. Okay. Forward is flexion. That's extension, normal position. Backwards is hyperextension. Twisting to the side is rotation. Circumduction is just taking and moving the head all the way around this way. Okay. And then lateral flexion is tilting the head toward the shoulder on each side. Okay, that's for the head. Then for the arm, we're going to flex and extend. This is the shoulder. Abduction, adduction. Circumduction, taking it out to the side. Motion. Okay. Hyperextension would just be taking it and putting it back like this. All right. You can put the elbow either in this position, and I'll do it in this position for internal and external rotation. This would be internal rotation and external rotation. That's moving the shoulder joint here. Internal rotation, external rotation. Okay, for the elbow, that will only do 2 things. Flex and extend. For the wrist, you have flexion, extension, hyperextension, and then you have a lateral flexion, or what they call ulnar and radial flexion. Radial would be towards the thumb, ulnar is towards the little finger. And then you have circumduction, which is going around in a circle. Then the hand, close the fingers, flexion, open the hand is extension. Then each one of the fingers can be pulled apart, which is abduction, and then towards is adduction. For the thumb, you can do all of those plus more. This is flexion, extension, adduction, abduction. And you can also do circumduction. And then the most important is your opposition, whereby you can touch each one of the fingers. Okay, that's for the upper body. Okay, we'll have you lay back down, and we'll go to the leg.